Mvusiwe Kaya is the Eastern Cape Premier spokesperson. Good evening, Mvusiwe Kaya. A pleasure to have you on. Firstly, there's been a lot of different reaction to the news of the beaches closing and the request that had come through from the provincial executive, at least in the Eastern Cape. Do you still stand by this decision? Do you still believe that it is the way to go?
Good evening, Kathy, to you and your viewers. Thank you for having me. Look, we understand where the concerns come from, but all of us have a responsibility to work together to save lives from being lost, because we are seeing a number of people that are dying because of the spread of this virus in our province. So government is continuing with the closing of the beaches, and we encourage the people of our province to really understand the predicament we are dealing with. I mean, look at the Easter weekend, for instance, the number of people that were infected and how that infection spread went to other parts of the country. So we rather do something that is proactive now than to deal with a mopping up, which would be very difficult later in the year.
Are you worried about people ignoring this regulation?
We are worried about that. That is why we're putting law enforcement. Municipal officers police officers are going to work with South African police officers and the traffic department of the provincial government. MEC Tikana Tsotiwe gave them more resources today in terms of vehicles to be able to do visible policing. But the most important thing is this: we encourage our people not to break the law, not to break these regulations, because we are saying don't go to the beach, don't go to swim, don't go to the open parks, to protect yourself from being infected. So if we can do that, we will make it easy for all of us, for those infected to recover, and we'll stop the spread of this virus effectively when we do that.
Of course, there are concerns around how law enforcement officers may conduct themselves, especially when carrying out some of these operations. And we certainly don't want to go back to a time where police officers are seen to be abusing some of the authority that they've been giving in terms of trying to control crowds.
You are right there. And we are saying to those police officers, they must continue behaving according to the law, acting according to the requirements of their jobs. And in the event there are people that feel police officers or traffic officers did not treat them well, they've got government institutions like IPID and other structures that they can report to. We are deploying these officials, assigning them to these places to save lives, to protect the people of the Eastern Cape from being infected by the virus and from spreading the virus. For that to be effective, it requires the people of the province to cooperate with the police officers.
How closely are you going to be watching how police officers do their job? Because you would have seen some of the videos that emerge of police officers firing rubber bullets at patrons who are at drinking spots, and that's certainly not the way to be responding to the situation. It only fuels tensions.
The issues of crowd control are the competence of the South African Police Services, and they deploy such actions when they see a need. They would be competent enough to talk to that. But we are saying to the people of our province, it doesn't have to get to that point. It doesn't have to get to a point of us deploying more police officers to help you protect yourself from being infected. Because when we deploy the same police officers, some of them get infected. So we're saying let's all mature to this responsibility and play our part by protecting ourselves and stopping the spread of this virus. A good behavior of a person staying at home or going to a place that is allowed or that is open and not exposing themselves and other people to infection is what we need as a province. We don't need people who are going to be rowdy, who are going to break the law, who are going to stay out after the curfew. We don't need that. We need to protect, we need each other. So that for us to do that, let's all play our part.
Mvusiwe Kaya, you're also facing a situation where hospitals in the Eastern Cape have come under increased strain and difficulties when it comes to admitting patients who are just needing emergency care, or even those who have contracted COVID-19. How soon do you think you're going to be able to resolve the situation and bring in additional hands in the province?
Look, we are working on that as government. As I speak to you now, we've got new hospital beds that have been made available because of the completion of some of our, I think about 52 health infrastructure upgrades that we're doing across the province. So that gives us beds like more than 1,400. Those beds mean they are resourced, they've got oxygen and all that. Some are ICU beds. So we are able now to accommodate as many people that need a hospitalization. But here is the good thing. If we want to reduce strain on our health system, we need to play our part by behaving properly. Government is resourcing these hospitals. We're putting more oxygen. We're now availing extra oxygen concentrates in clinics to make sure that district hospitals have oxygen, the bulk oxygen tanks. We're working with the company that is contracted to provide those to government. We are also addressing the shortage of staff. We have now deployed additional tube and doctors to PE. We're working with other social partners to avail additional doctors. The hospitals of the Eastern Cape still have got space, but we don't want people who don't need admission to go to hospital, because that doesn't help the system. It makes things worse because more people get exposed to possible infections.
How many additional staff in terms of numbers do you actually need in order to ensure that this additional capacity of 1,400 that you've spoken about can be fully utilized?
Those beds were built, were refurbished, knowing that they will be serviced by the staff that is in those hospitals. But the predicament we are seeing now, which is a global phenomenon, is that as more health workers get infected, unfortunately some of them lose their lives. You now need to get more people employed into these positions to assist you to continue working. We are working with the universities now who have availed their students who have completed community service in all the disciplines of the health fraternity, availed for these hospitals to work with the experienced doctors, to work with our nurses, to provide health care to our people. So all these hospitals, the private sector is also contributing some of the health personnel. We are providing these people to close the gaps that are created by health personnel that is infected and those that we have sadly lost because of this virus.
Sure, but what's the number in terms of staff complement that you would be looking at in order to close that gap?
Look, I don't have the number with me now because the numbers change all the time because of the situation we are dealing with. The number that we had last month would not be the number that we have today because of this dynamics. But the focus of government is to make sure that in prioritizing filling of vacant posts, we are putting health as a priority because we're dealing with a health pandemic. So that means all the processes that health has started have been accelerated. That's why we now have appointed additional managers in the field hospital in Nelson Mandela, the Chabula Nweni Field Hospital, so that we address challenges that we've picked up in that hospital, that there were no managers at some point when numbers were going down. We've brought in additional nurses to assist with provision of health care to those patients. So what we do is we look at the data and we move with speed in attending to issues that are within our reach as the provincial government. And those that we require national government to assist, national government is approached to be able to provide that support to government.
What is the last number that you are working with, Mvusiwe Khaya? So this number from last month when you identified a shortage of healthcare workers, how many are we speaking about here?
We wanted to employ about 7,000 health workers in the province. And the last number that is updated that I had, we had appointed 90% of that number. So that shows the government has been availing health workers to these health facilities in rural communities, in urban areas, in field hospitals. Remember, we initially had planned to have field hospitals in all the districts of the province. And then we saw that let's rather invest that money in expanding the available we assign health workers in those hospitals to take care of the new wards that we have. So that's what worked for us to say those that we have appointed between March and now, they're going to continue assisting in the field in the hospitals that we have refurbished now.
Vusiwe Kaya Sigweja is the Eastern Cape Premier's spokesperson. Let's leave it there for tonight.